I've had 2 C-sections now because Nora was breech. Didn't want to flip around. So I had my first one 2 years ago, and then had, well, I guess, it's actually almost 3 years ago. Oh, it's almost 3 years ago, and now I just had one almost 11 months ago. And he did the version attempt, and it didn't work. And so he said, well, now I need to schedule your C-section. And he said, but I'm doing this great thing with these absorbable staples, and so we'll use those on you if you're game for it. And I was like, sure, sounds good to me. So yeah, but that was, I think, the first time I'd heard about them. Yeah, I remember after I had Nora, after my first C-section, it was still fairly new, I think, the absorbable staples. And so the nurses, when they were coming in and checking my incision afterwards, I remember them all talking about how nice it looked. Wow, that really looks great. And then I would show my husband and stuff too, and would look at it afterwards, and it just looked so, it was so easy to take care of because I had, I think, steri strips on at that time, but after the second one, they were using instead Tegaderm and putting Tegaderm over it. But, I didn't have to get staples taken out. I mean, there was no infection, no problems at all with the incision, it didn't hurt really. I mean, well, pain pills, yeah, a little bit of pain pills, yeah. Just as any incision after being cut open, but no problems with it at all. Oh, another plus that I keep thinking too is how fast it is. And so I was able to get back to the floor so quickly, and I breastfed both of my children. And so for me, that was really important. I wanted to try to get that first feeding in within half an hour of them being born, which they recommend now with breastfeeding, or at least half an hour or an hour. And I could get upstairs so quickly and be back with my baby, which it was just so fast that I got back upstairs. I didn't feel like I missed much. I think it was maybe my second day in the hospital I took a shower. Yeah. I'm a family physician. Yeah, and I take care of OB patients as well, and I deliver babies still too. I don't do C-sections myself, but I deliver babies now as well because I have quite a few patients as well that I send for C-sections. And most of them now, I think, are getting the absorbable staples and are loving that. Not having to get staples taken out, faster than the subcuticular stitching, and definitely better than metal staples, I'd say, because you don't get any of that inflammation around the outside of the, around where the staples enter the skin. And, there's scars afterwards. Well, in mine, really, you could barely tell where it was. I remember before my second C-section, when there were pictures being taken of the scars, it was so hard to see. Yeah, we had to mark it with a pen so that we could take the picture. And even now, it's hard to, after my second one, it's hard to see where it is for the most part. You have to look pretty closely. I would definitely recommend this type of closure for my patients, for definitely C-sections and other things too, now that more surgeons at Fairview Ridges are using them.